this is Anjaly from Sky High English Academy. Today, we are going to practice some questions from Part B of your reading subtest. So before we start our practice, let's have a look at what Part B is all about. Out of your 42 questions in OET reading, Part B has 6 questions. You'll be reading 6 short texts on different subjects. Part B focuses on workplace communication and asks you to understand the purpose, main idea or a specific detail of the text. Usually, you get to read memos, manuals, notices, guidelines, emails and policy documents. Your questions are 3 option MCQs and you need to choose the most appropriate option as your answer. After you complete Part A of your reading, you get 45 minutes for attempting Part B and C. So I'd recommend you to spend around 13 minutes for Part B. Now let's move on to our practice. Have a look at the question on the screen. So from the question, we know we are going to read a memo. So what are memos? Memos are very common among our workplaces and it usually conveys an update or a reminder about a procedure or a policy. It's also clear in the question that we need to find out the purpose of this memo. So let's take a minute and read and understand the question displayed on the screen carefully. I believe all of you have read the text, so let's look into it to make sure that we have understood everything. From the heading, it's clear that the memo talks about spillages in the emergency department. So what does the word spillage mean? It means the act of spilling liquids or fluids. Which brings us to the text. Let's have a look at the first sentence. It says, preventing falls is the most important thing in an ER and lately there have been concerns about spillages of fluids, particularly hot drinks from the vending machines. So this essentially says prevention of falls is very much important in the emergency department and lately people have been spilling hot fluids. Moving on to the second sentence, it says when such an incident happens, the assistant on duty needs to follow the already set protocol and they need to warn the patients and others about the risk of falls. Secondly, they need to place a sign and mop the area using a tissue before they call the cleaning personnel. Once the area has been cleaned, they can remove the sign. So, these are the things that an assistant on duty needs to do when somebody spills something in the emergency department. The final sentence of the text says, if there is a possibility that a patient might cause a spillage, you need to provide them things to prevent it and inform the responsible staff. Essentially, the whole text talks about how prevention of fall is important and what are the things the assistant on duty needs to do when somebody spills something, and finally, if they feel like a patient might spill something, what they need to do. We have read the question, we have read our text and we have clearly understood what the text conveys. So now we are going to choose our answers by looking at the options. So what we are going to do is, we will read the option, understand the meaning, then we will reject those options that conveys something that's not at all given in your text. Then we will also reject options that conveys exact opposite of what is mentioned in the text, or something that is incorrectly given. What remains would be our answer. So now let's have a look at the options. Let's have a look at option A. Option A says, inform staff of new procedures. Do you think the memo is informing the staff of new procedures? The answer is no, because it's clearly mentioned that the procedures explained are already established. That means it's not something new. The option is saying opposite of what's given in the text. That's why it's not our answer. That brings me to option B. Option B says outline some changes in procedures. We can also eliminate option B because nowhere in the text changes in procedures are explained. They're not asking someone to change how they manage spillages. No, that's not the case. So we can eliminate option B as well. That confirms our answer is C, which is remind the staff about existing procedures. Yes, the memo is reminding the staff about an already established protocol as mentioned in the second sentence of our text. So let's have a look at the phrase established protocol. What do you mean by established protocol? Protocol is something that you do, that you're supposed to do or supposed to follow at a certain situation. So what do you mean by established protocol? Established protocol is nothing but something that's already in existence, something that's already in place that should be followed. So this confirms that our answer is option C. Alright, let's move on to the next question. Please read the question that's displayed on the screen. So from the question, it's very clear that we are going to look at guidelines this time. So what are guidelines? I'm sure as medical professionals, you are very much familiar with the term, because guidelines usually tell us what to do or what not to do or how to handle a certain situation. So in the question, they have asked us to figure out what the guidelines are trying to establish. So now, as before, take a minute, read your text and understand the meaning. So from the heading, it's apparent that this text is about Doppler assessments. So that means we are going to have, we are reading guidelines on Doppler assessments, when to do Doppler assessment, what to do and what not to do, things like that. So the first sentence says that only trained nurses should assess for leg ulcers because a poor evaluation can result in wrong treatments or it can hurt the patient. The ulcers are classified into 3 and some patients can have both venous and arterial ulcers. After saying this much, the text talks about a handheld Doppler device that is necessary to check for arterial disease. And if the patient does not show any signs of arterial disease, they can be treated for venous ulcers, and compression bandaging is mentioned as the best treatment for ulcers, and the text also says when not to use them. It goes on to talk about another form of Doppler assessment, that is waveform analysis, and who usually carries it out. The nurses, community nurses or practice nurses, can talk to a tissue viable nurse to see whether this type of assessment is an option for their patient. The final sentence of the text conveys in what situations waveform analysis can be used instead of traditional Doppler assessment. The final sentence conveys in what situation waveform analysis can be used instead of a traditional Doppler assessment. So, essentially, the whole text talks about ulcers and two different ways to assess for them. The first one is handheld Doppler device, which is for arterial disease. The second one is waveform analysis. And it also says when waveform analysis can be used instead of the handheld Doppler device assessment. So we have read our question and we have understood our text very clearly. So now let's have a look at the option and try to understand what the guidelines are trying to convey. Now let's have a look at our option A. Option A says how to operate a device. So what do you think about this? Do you think the guidelines were trying to convey how to operate a device? Yes, the text talks about or mentions Doppler device, but nowhere they tell us how to operate it. So this is not our answer. Which brings us to option B, which says what to do if a device cannot be used. If you look at the text carefully, it clearly says in the last sentence how we can use waveform analysis instead of a traditional Doppler assessment. Here, the phrase traditional form of assessment is nothing but handheld Doppler devices. So essentially, this sentence is trying to say if the patient cannot lie flat and the handheld device cannot be used, in that situation, waveform analysis is another option. So definitely our text is saying what to do when a device cannot be used. So these details confirms that B is the answer. But to be sure, let's check our third option as well. Option C says who can decide whether it's appropriate to use a device. So this detail can be a bit confusing, because in the text towards the end they have mentioned that community nurses or practice nurses can discuss or can talk to local tissue viability nurses about using waveform analysis for their patients. So they are mentioning, or they have mentioned, that these nurses can talk to each other about waveform analysis or whether waveform analysis can be used for some patients. However, nowhere it's mentioned who has the authority to determine which form of assessment is appropriate. So, this confirms that option C does not answer the question what the guidelines are trying to establish. This confirms that option C does not answer our question what the guidelines are trying to establish. So, we can reject option C. That brings me to the last text for today. Let's try something different now. You can see your next text, question and the options on the screen. Take 2 minutes. First read your question, understand it, then read your text. Finally, read the options and choose the most appropriate option as your answer. That's 2 minutes. I hope you have found the answer. Our answer is option A. That has been our last question for today. I hope this was helpful. We'll see you soon with another video. Till then, take care. Thank you.